Lateral hip pain is awful, but these exercises can help you to get rid of it. My name is Dr. Jared. If you kind of pop your hip out to the side and feel this area, you're going to feel a bone down there. It's called the greater trochanter of your femur. There are actually 7 different muscles that attach to this area. And so because there's so much going on, we also have some small fluid-filled sacs in this area to add cushion and reduce friction. Those sacs are called bursa. If they get irritated and inflamed, that can result in a condition known as bursitis. If you've ever heard of hip bursitis before, that's what it's referring to. However, recent studies are showing that this problem isn't as prominent as we once thought that it was. In most cases, it's probably irritation of some of those tendons in a condition known as tendonitis. So how do we get rid of it? We need to do the right stretches in a pain-free range of motion to reduce that friction, reduce irritation, and improve motion. That's going to help us to feel better now. But then we also need to do the right strengthening exercises so that we improve the quality of the movement in the hip to prevent pain from coming back in the future. And of course, you get both with this video today. I hope these help your hip to feel amazing. Let's jump in. The first stretch that I want to show you is one of my favorites for your hip abductors, or the gluteus medius and minimus group right up here. This is going to be a supine glute stretch. Now for this one, you will need something to stretch with: a belt, a towel, a sheet, a rope. I like this stretch out strap. It's got these loops on it that make for really good handles. This is how we're going to do this stretch. You're going to sit with your legs out in front of you, take whatever it is that you're using and loop it around the affected leg. So right now it's around my left foot, so I'm going to stretch out my left leg over here. Lie down on your back. Now in this position, I'm going to grab the tails and start to introduce a hamstring stretch. So I can pull up this way to stretch out those tight hamstrings. But what I really want to do is take that foot, right now it's my left foot, I'm going to actually pull it over and across my body just until I get a good stretch all down the outside of that left leg. And as you pull that over, oh man, you're really gonna feel that. That creeps up right into the glutes and then right into that area right above that greater trochanter, right where those affected muscles sit. And what I would do is hold it in a comfortable position. I don't want this to be painful. In fact, none of these should be painful. I want it to be just in a comfortable stretch position. And then you're gonna hold that there for about 20 seconds. And then we're going to repeat that one 3 times. Now, to work the rotators, we need to stretch tight rotators out. And so to do that, let's first do an internal rotation stretch. So I'm still laying down here on my back. I'm going to separate my knees, separate my feet as wide as I can. And now what I'm going to do is I'm going to stretch this left leg by dropping my left knee down towards my right foot, just as far as I can comfortably take it. And as we rotate internally here, you're going to feel that stretch right here through the kind of the outside and maybe even up in through the front of the hip. Once again, keep it comfortable, hold it in that position for about 20 seconds. On this one, I actually like to do this one side to side. Oftentimes, if you're tight on one, you're tight on the other. And so I'm going to rotate the right over towards the left foot to rotate and to stretch that out. I would hold that for 20 seconds and then repeat that 3 times to both directions. That is again to stretch into this internal rotation motion. We also need to stretch into an external rotation motion. The piriformis stretch or the figure 4 stretch is my favorite one for that. I'm still laying down on my back. These are convenient because you can just do them all in succession. I'm going to cross the left leg over my right. And so right now my left ankle is up on top of my right knee. With my hands, I'm going to grab right here behind my right hamstring. Go ahead and lay down comfortably. And then what I'm going to do is pull that right knee up towards my chest as high as I comfortably can, just until I get a good stretch in those deep hip rotators. You should feel that deep in that left glute area as you pull that up towards you. And once again, 20 seconds 3 times is a good number to shoot for. On that one, I do like to point out to people, like I realize it's not always convenient to lay down in the middle of your day, but you can also do that one seated. If you're here seated, you can cross one leg over the other. Now with this, you might not have the range of motion to get into the full stretch. So keep in mind, the higher I keep this knee, the less stretch I'm going to feel. And so you might start with that knee actually pretty high just to keep that stretch comfortable. But then what I would encourage you to do over time is start to apply a little more pressure to the knee to see if we can drop it down further and further and further until we're getting closer and closer to parallel to the floor. And that would be an indication that your hip rotation motion is increasing. But the same parameters apply on this one. I'd hold it comfortably for 20 seconds, and then I would repeat that 3 times. And then the last stretch that I like to show for this condition is a standing version of that hip abductor stretch. This is the ballerina stretch. And yeah, you're gonna see why here in just a second. If my right leg was the affected leg, what I wanna do is step over that with the unaffected leg. So my left leg crosses over in front, and then I'm gonna push my right hip out towards the right just until I get a good stretch. And honestly, I feel that from the top of my hip down into my greater trochanter, and that even runs down the IT band a little bit. I wanna hold it in a comfortable position for 20 seconds, 3 times. Now, if you are very painful, that might be a good starting place right there. That might be as far as we can take it. But if you want to take that to the next level, what I'm going to do now is with my right hand, reach up and over my head, and then even over here to my left as I push my right hip out to the right. Basically, what I'm trying to do here is make this whole right side of my body as long as I possibly can. And honestly, that really takes that stretch to that next level. That really enhances that stretch. It's a good one to work up into. Parameters are gonna stay the same. Hold it for 20 seconds, repeat it 3 times. Hey, I am stoked to announce our all-new membership area here on Tone and Tighten YouTube. If your hip is feeling better, if you've gotten some relief from this video or any relief from any of the videos that I've done and want to show your appreciation and support, the membership area is a great place to do that. But here's the thing, it's one thing to do exercises to get out of pain, but it's another thing to live a healthy lifestyle in such a way that you don't get that pain in the first place. Those are the topics that we're discussing on the backside of the membership area in private members-only videos that I've created just for you. So if you're interested in learning more, if you're interested in checking that out at all, just hit the join button down below this video where you can learn more information. Okay, by this point, if you've done the stretches so far, your hip's probably feeling pretty good. But what we want to do now is start to introduce some strengthening exercises so that that pain does not return. I've got 3 beginner exercises that are here in a non-weight bearing position, and then we'll progress that to more intermediate advanced exercises with 2 more after this. And so the first thing that I always like to introduce would be a clamshell exercise. You're going to lie down on your side with your painful leg up. Now in this position, I've got a slight bend in my knees. I'm going to keep the soles of my feet together and separate my knees up towards the ceiling and then slowly return back down to that starting position. So I'm rotating through that painful hip. I'm kicking on some of those hip rotators to rotate my knee up towards the ceiling and then return it right back down. Most people are pretty tolerant to this. I usually recommend about 15 to 20 reps on this and then repeat that 3 sets. If that is super easy and you have access to some of these resistance loops, you can loop that around your knees, and then all of a sudden that adds a little more resistance to that motion. Next is going to be one of my favorite for your glute group, so your glute max group here in the back. We're gonna do some bridges. Lie down on your back with your knees bent. You're gonna engage your glutes. So I want you to squeeze your butt together. That's always the first step. So squeeze that butt together nice and strong, and then use that contraction to lift your hips up towards the ceiling. Hold 1, 2, and then return right back down. And once again, most people are usually pretty tolerant to this. 15 to 20 reps for 3 sets is a good number. If that is easy, the more effective way, maybe the more efficient way to treat this problem and to improve stability in your hip is gonna be a single leg bridge. You're just gonna extend one leg out straight, your pain-free leg, let's extend that one out straight, and then with one leg, we're gonna contract the glute to lift the whole body up towards the ceiling, hold 1, 2, and then slowly return right back down. But again, that's a little more advanced version of that. 3 times, 15 to 20 reps is a good number to shoot for. And then finally, the last one that I want to show you in this non-weight bearing position is going to be hip abduction. I'm going to lie on my unaffected side once more, so my affected leg is up. I've got a bend here in my bottom leg, so right now my left leg is bent, my right leg is out straight. Now what I'm going to do is focus on pulling the heel of my right foot up towards the ceiling and back behind me slightly. And so it's kind of this oblique angle a little bit. So you're going to keep your leg nice and straight. You're going to keep your toe down, heel up. Heel goes up and back behind you. You should really feel that activating these muscles right here above that greater trochanter and kind of behind it a little bit. And that's the position that we're after right there. I would repeat that for about 10 to 15 reps and then repeat that 3 times. Now, as pain decreases and strength improves, we want to progress our exercises from a non-weight bearing position to a more functional weight bearing position. These are the 2 exercises that I love for that. The first thing we're going to try are some single leg deadlifts. You're going to stand on your affected leg and then hinge at your hip. Your unaffected leg comes behind you as you fold forward at the hip. I don't want you to bend your lower back so your lower back stays nice and straight, but we're going to just fold forward as far as pain and strength will allow. And so for some of you, it might not be very far. And then we're going to return to that starting position. But then what you should be able to do is gradually get further and further into a deeper hinge at your hip to work that muscle and to work that hip through more of your available range of motion. Really trying to feel this right back here in the glute. We're also gonna feel it in the lateral hip, the stabilizer muscles as well. And typically what I recommend there is 3 sets of 10 reps. And then the next thing that I wanna do is work the abductors or the hip abductors, the hip stabilizers a little more aggressively. I love band walks to do that. You can use the big kind of thicker bands or you can use the smaller bands as well. Either one will work great. What we're gonna do is loop that right around both of my legs and pull that right up above my knees. Now in this position, I'm gonna drop into a mini kind of quarter squat and then take a big step with my leading leg and a half of a step with my trailing leg. So I want there to be some tension on that band at all times. But oh man, this is probably one of my favorites to really target and isolate all of those lateral muscles on the side of your hip. You're gonna take 3 or 4 steps to the left, and then we gotta keep things even, so we can take 3 or 4 steps to the right. Just maybe even like if you don't have as much space, you're only taking 1 step left and then 1 step right. You can do things to make it work. And what the recommendation there is about 10 steps each direction, repeated 3 times. I hope these help your hip to feel amazing. Thank you so much for watching.